Police shed light on how they're dealing with a delicate issue after a woman in a mental health crisis takes her own life. The woman who forced the evacuation of the Wisconsin Psychiatric Institute and clinics yesterday has now died from a self-inflicted gunshot wound. Jean Gibson was a patient at that facility, but was banned in February after allegedly making comments to staff there about having a gun and, quote, knowing how to use it. Police say she showed up at the clinic Tuesday morning, exchanged words with staff, and then fled into a field. The search ended with Gibson taking her own life. Too often recently, we have seen incidents of individuals in mental crisis ending violently. News reporter Dave Delosier is here with more on that problem and possible solutions here, Dave.
Eric and Michelle, you know, law enforcement officers from 3 different agencies went into that field yesterday to try to find Jean Gibson. They knew she was potentially a danger to the community and to herself. They also know too often police are asked to deal with the problem of the mental health care system that can't seem to handle it.
It leaves you with kind of a hollow feeling when we can't help somebody.
It is a situation that can only be described as dangerous, searching an overgrown field for an armed individual with a history of mental illness.
When there's a firearm involved, that's very tricky because it's a matter of split seconds to take a weapon that you've got aimed at yourself and aim it at someone else.
In the end, officers were not able to save her. Worse yet, too often, law enforcement officers have been called upon to deal with an individual in mental crisis.
But as a result of cutting services and social services, medical services, is that really the jails have become the place where we are confining people with mental illness. And the jails are just not suited for that.
No, it's not an appropriate, a much more appropriate response is an expansion of community services.
Journey Mental Health is on the front line of treating individuals in mental crisis. In 2012, they treated nearly 9,000 patients in Dane County. They have seen the success that can come from providing proper care.
We believe with the right services in the community, people are going to recover from mental illness, they're going to move ahead, they're going to become productive members of our community, and we see that all the time in our program.
But with more demand than there are services available, it is left to those with a badge.
We really feel like we are kind of holding a line here, hoping to be reinforced. And we can only do that for so long without tragic results, and the line isn't getting reinforced.
Now help may be, however, coming soon. Journey Mental Health officials are hopeful that the state funding for the comprehensive community services will help to keep people out of mental crisis. Counties are eligible for that service. And Eric and Michelle, it is hoped that that program will help to reach some people that right now are on wait lists and are having trouble getting services.
You certainly feel, as a person, for anyone involved in that kind of situation, and certainly a topic that's getting a lot of awareness these days.
It's an enormous problem in our community, and it really needs to be addressed.
Absolutely. Thank you, Dave.
Thanks for that.